Are we live?
Yeah.
Cool. Hey guys, so it's Shelby and Dr. Kat. We're here at Amara's Orem location, and for today's Facebook Live, we're going to be doing lips. And we kind of already had a little consult. We know the plan of what we're going to be doing. The product we're using is Juvederm Ultra Plus. It's a perfect product for the lips. It gives a plump, but it's subtle and smooth, and I really like it. So we're just going to get started. We already numbed her, and we didn't want this to be a huge, long video. So we already numbed her, already did the consult. If you have any questions, just shoot us some direct messages, and we can answer them as we go. So,
Do you want to talk about the promo that we're doing with Juvederm?
Yeah,
so while Shelby's getting started here, we are doing a Valentine's promo. So through the month of February? Is that right, Elsa?
Yeah, it's January 15th through February 28th.
So, huge deal that we're doing. You can get $100 off your lips, or you bring a friend and you both get $200 off your syringe of either Juvederm Ultra or Ultra Plus. And we can help you decide which product is best. They cost the same, but great deal on that. So bring a friend and get your lips kissable for Valentine's. So Shelby is doing what we call the micro droplet technique. So you can see her entrance from what we call the vermilion border, which is where the pink lip meets the white. And she's able to do tiny little deposits of the filler. And you can see how that adds a really nice little flip to her lip and some subtle volume. And she's using our little vibrata buzzy, which distracts the pain nerves to help make it a little more comfortable.
Good. And there's also lidocaine in the product, so I do a bunch of tiny little pokes, and then those are usually the most painful. I mean, we numb. It's really good numbing cream. Lips are probably the most sensitive area to get filler. But after this first little round, it goes numb, essentially, because there's lidocaine in the product. So I just do one little round and I wait for a second, and now we're going to go,
that already.
go
You
back
can
and
see.
do a second
Looks
little
really
round here.
So she's also using an insulin syringe, so teeny tiny needle.
31 gauge needle.
That makes it as comfortable as we possibly can.
Good job. I'm going to line her border real quick here. Little poke here. Good.
This is called the Cupid's bow area. And lining, what she's doing here, gives us back that border. Many of us, as we age, that border gets flat. Some people, genetically, it's a little more flat. And so when we give you back that border, it just creates a really nice line there and holds your lipstick really well so it doesn't feather.
How are you doing?
Good.
She's massaging and smoothing out the product a bit. Helps prevent lumpiness. Some lumpiness is normal while it's healing.
How do we look?
That's looking really pretty.
Under the mirror. So when I do lips, a lot of people are scared to do lip filler.
Yeah, I love it.
So I go super slow, which I think is really important because
I love
it
it, and it
decreases.
removes these lines.
Yeah, it just hydrates at the area.
Yeah.
Give a tiny bit of volume and just hydrated it. So hyaluronic acid is what the fillers that, at least the fillers that we offer here at Amara, they're made of hyaluronic acid, which is a really hydrating agent. So when I say lips, a lot of times I post about lips and I'm like, hydrate the lips. People don't get that. So it just means that the filler is actually like a hydrating agent. It pulls in a little bit of water. So it really makes your lips look nice and hydrated. So if you kind of zoom in on her lips, you can see that this side just looks quite a bit more smoothed out, a little bit more hydrated. Not too crazy though.
Notice how Shelby left some lines there, because we don't want it to be slick, because then it's a giveaway for filler, and I'm sure you've seen those lips. So we want it to look natural, so we maintain some of those righteds in the lip.
Perfect. So, and I always let people kind of take a peek in between and say, oh yeah, that's perfect, or yeah, I want a little bit more. I mean, this is totally a group effort. You're the boss. You go as big as you want, and I just kind of listen to you and do what you want, what shape you want. They're totally customizable. So we're gonna switch sides. How you doing pain-wise?
Good.
Good. Okay, so we only did, let me switch me out. I'm going to use one of these guys here.
Just take your cap.
So we only did 1/10 of a syringe for perspective here in that upper lip. So the nice thing about Amara here is we only use the amount of filler that's needed. We don't slam the whole syringe in. I mean, whatever we don't use, we put your name on it and we keep it for you, and you can use it for future lip augmentation. So
Yeah, it's good till it expires. So like this one we're using won't expire till 2019. So if we have extra, she can come in for touch up, or when she wants a little more. What Shelby was telling her is that the center of the lip is the most sensitive, and that's very true.
Good. First round, that's the worst part. And then it gets better. Good. So usually before filler, I recommend that people stop taking any blood thinning medications like vitamin E, aspirin, Excedrin, fish oil, Aleve, anything that can thin the blood, because that increases your risk of ibuprofen especially, of bleeding and bruising. So
we also tell people expect some bruising. We of course try not to bruise you, but there are lots of tiny vessels in the lips and it's impossible to see them all. So we do our best, but plum lipstick might be your friend for a few days. Bruising will heal just in the normal amount of time that it takes your bruises to heal, so about a week for most people. A lot of people like to take a supplement called Arnica, which you can find at health food stores. You can take Arnica dissolving or pills. There aren't good studies that show definitively that it helps with bruising, but a lot of people feel that it helps them with their bruising. Pineapple also has an ingredient in it called bromelain, which can help with bruising as well. So some people eat some pineapple before they come to see us and they feel like it helps them. Neither of those are going to hurt, so we're not going to tell you not to do it. And if you feel like it works for you, that's great. And there's also Arnica cream that you can put on a bruise that's supposed to help your body break it down a little faster.
She's starting to swell right in there, which is normal. So the important thing also to understand with lips is they do tend to swell. So a lot of the time, I don't chase swelling. You can tell she's already starting to swell right in this area. So I put the same amount on both sides. I know that I did because I keep track of it as I go. I'll take that little guy. I don't chase swelling, so I'm not going to put more filler over here to make it look equal because that's swelling. And if I did that, then this side is going to come down and this side's going to look bigger because I chased the swelling, if that makes sense. So I always have my lip patients come back in a week or two when swelling's coming down, and I always keep a little extra of their product just for touch-ups to make their lips look totally perfect. So
during the healing process, if you do notice any lumps or bumps that you feel, usually if the lump or bump is tender, it's a bruise that might be internal, so you might not even be able to see it. If it's a lump or bump that is not tender, that's usually product, and it should integrate with your lip over 2 weeks to up to a month, but usually closer to 2 weeks. If it doesn't, come back in because we have some techniques that we can use to soften those and make them go away. Sometimes your body creates a little bit of a scar tissue capsule around some of the product, but we can take care of that. Absolutely.
A new clean piece of.
It's looking really good, Brett.
Alcohol off the bottom here.
It's just some alcohol she's using since we've been touching with our non-sterile gloves. They're clean, but they're not sterile.
Keep it nice and clean. Okay, bottom time. Okay, so everyone likes different shapes in the bottom, and we kind of talked about it. We're going to just kind of follow the natural shape of her bottom lip. She has more fullness in the tubercles here, which is pretty normal, pretty common, and gives you that pout, and she has it naturally. So we're just going to follow that and just augment it kind of overall. So open up for me. Good. Close your eyes.
Lip proportion is also something that we pay really close attention to. So in a genetically Caucasian woman, the ratio of bottom lip to top lip is usually either 60-40 or 70-30. So we try to maintain what's normal and natural both for you and what will look most aesthetically normal, even if we do change those proportions a bit. So sometimes we get people that come in, they say, I just want some in my top lip, and that's not always a great idea because we may need to add some to both lips in order to maintain the proportion.
I'm going to grab one that's wet, Kat.
Really good. Do you want to come back on this side?
I'm going to do a tiny bit more. So before she just had a tiny little lump on the right lower side, so I'm just trying to, like, I don't know, disguise that little lump. A lot of people have kind of some lumps naturally in their lips, so a lot of the work that I do on lips is actually like correcting asymmetry, which we all have. You know,
either lumps or dimples that once you start adding filler become more prominent.
Good, and open. Good.
That's where the artistry really comes in.
Yeah.
So here she's adding that volume to the middle third, which is going to look really pretty.
Okay. How you doing pain-wise?
Good.
Good. Scale 1 to 10, where are you at? With the pokes?
I don't know, like 5?
Like a 5? Okay. Not too bad.
Not
The
terrible.
bottom's not as bad as the top.
Yeah. Okay, open up for me.
So what you see her doing is measuring with her needle, and that's just a technique that we do to make sure we put it right where we want it to. And you'll see most of us do that in some way or another.
Almost done. You're doing good.
It's fun with 4 hands, right?
I know. That's what we all need. Just gonna massage the middle. Clean that off a little bit. Thanks, Kat. Yeah, round 2. Shape her out. Okay, Missy. So, I'm going to shape you a little bit. This feels kind of funny, but shaping's important.
This shaping that Shelby's doing can make a huge difference. It prevents sausage lip.
Can you get another one wet? Clean one, thank you. So we've only used about, we did 0.1 on both sides in the upper and 0.15-ish in the lower. So 0.3, 4, 0.5. So we've done half a syringe.
And that's all we've done.
In her lips, and we totally camouflaged that bump there, which is good.
And she is starting to have some swelling, totally normal.
Yeah.
Usually we have you take a look right after and we say, remember this, because tonight and tomorrow you're going to say, what did I do?
Yeah, you're most swollen the next morning.
So if you're trying to hide it from your mom or your husband,
Your girlfriend, close your lips.
if they're going to be
Look
out of
pretty.
town
Take
for a
peek.
day. Really pretty.
Ooh. Yeah.
Remember your swelling though.
I know.
Yeah.
Yeah, see ours? A little bit swollen. So I
Oh.
usually tell people, a lot of times I can call in a mild steroid that helps with the swelling if they have like an event to go to or something. I want to sit our head up. And if you
Might
take
be a good idea for
Benadryl
you
the
guys
night
to
of, like tonight, it will help with the swelling. Icing helps a ton. We'll get you some ice for the way out. Usually it's the worst, like when you wake up tomorrow morning. So if you sleep with a few pillows behind your back so you're a little bit elevated, that helps too. You'll wake up in the morning and be super swollen, but by like 11 o'clock tomorrow, noonish, they'll be back to normal. So,
Wow.
yeah. Any other questions?
No.
No
Love it.
aggressive kissing for the next few days.
Oh yeah, don't take them for a test drive tonight.
No problem.
Lay low for a day or two.
That's about the only aftercare that there is.
Yeah,
though.
lips are pretty simple, so
Do you want to talk about the promo one more time?
yeah, go ahead.
Oh,
Yeah.
we still have
Did
good
it
luck.
right.
We're okay.
I'm glad we got that on
The
tape.
weird break of not cursed. It's okay.
The promo is January 15th through the end of February. We are doing a huge discount on lips where if you come in, you get $100 off your syringe. Or if you bring a friend who hasn't had injections, or is it just any friend?
just when you bring a
Oh,
friend.
sweet, even better. Bring a friend and you both get $200 off of your syringe. So that's an incredible deal. We haven't done one like that before. So just in time for Valentine's Day to get awesome lips. And then you can take them for a test drive.
Yeah, if you wanted, I would recommend doing lips like at least a week before Valentine's Day, like
Or
5
after
days, or
Valentine's
after.
Day.
But yeah, or you can ask for lips for Valentine's.
Yeah, totally.
But if you're trying to like, you know, be discreet from your significant other, I'd get them done like 5 to 7 days. Honestly, I've had my lips done, and my husband did not notice. He was
And
like,
she
so
swelled a
oblivious.
ton.
I did. I swelled like anaphylactic reaction swelling, like huge. I'm just a sweller. Some people are swellers. She's a sweller too. You
Yeah.
can tell like immediately she's starting to swell.
She's gonna get a little prednisone for
But
sure.
honestly, men are like oblivious. But a lot of men get their lips done too. So,
Yeah.
but
Even if
yeah.
you've never had lips, we can give you.
Yeah, lips are really fun, and they're not just for like plumping. They're also for anti-aging. A lot of women start to develop like peri-oral lines. We call them smoker lines, even though you haven't even smoked a day in your life. But filler, yeah, from sucking on your Diet Coke, you get those lines. So filler helps to smooth those out and really takes like years off of you. So
I like just having it like, I feel like, because I'm 37 now, like I feel like it just gives it like what I used to be.
a little bit
It's like,
youthful.
yeah, like I've
Yeah.
just, they've thinned out a little bit. Like,
Yeah.
I feel like I'm just not necessarily doing a bigger, it's just what it used to be.
Yeah, yeah, because you start to lose volume in your lips and in your cheeks first. That's actually noticeable. So, any questions from there?
And we both have our lips done.
Yeah,
I have a full syringe of velour in mine.
and so do I. So there we go. Rock on. Thanks, guys.
Perfect. Bye.
Bye.
So how come, like, what would you choose, like, velour over Juvederm?